which are related to the superior poles of the kidney. Because I'm telling you now about the relations to the other organs. So the suprarenal, the adrenal glands are located on the superior medial aspect of each kidney. And now the renal fascia, it is located around the kidney. And outside of the renal fascia is located the pararenal fat. Simple is called the retroperitoneal. Is outside, yes, of the renal fascia. Perirenal fat, so the fatty renal capsule is inside, yes. So is derived from the extraperitoneal fat and continues with the renal hilum. This renal fascia, it sends collagen bundles through the fat. Collagen bundles, the renal fascia and the fatty tissue along with the tethering provided by the renal vessels and ureter hold the kidneys in a relatively fixed position. Yes, we know that the kidneys can move, yes, but generally we can say that the kidneys are in a fixed position. And now let's look better at it. So yeah, it's a renal fascia. That's the anterior layer of renal fascia and the posterior layer of renal fascia. Outside of it is located the pararenal fat, retroperitoneal fat. It's also here, yes, because we are talking about outside of renal fascia. But inside, so here, inside is located the perirenal fat, so fatty tissue, which is also inside in the hilum of kidney. Look that in this perirenal fat is located the suprarenal gland. So in this fatty tissues, kidney is ovoid bean-shaped organ. It has anterior and posterior surfaces. Medial border is concave, and the lateral border margin is more convex. Superior, it has the superior pole and the inferior pole. The posterior surface of kidney is more flat than the anterior surface. The renal hilum is located at the concave medial margin. It's the entrance to a space within the kidney, the renal sinus. Renal hilum is a vertical cleft where the renal artery enters this renal hilum, renal vein leaves the renal hilum, and the renal pelvis, which changes into the ureter, leave the renal sinus. But look, we need to see the relation of this relations of this vessels and structure. Look, that vein should be anteriorly to the artery, and artery is anteriorly to the renal pelvis. Look, closer to the renal sinus, yes, it will be changed because the renal artery sends a segmental arteries, so somebody can say, oh, but artery is anteriorly to the vein, yes? But we are talking about these relations before this renal sinus. We will see it soon. So here, yes, this place. Vein, artery, and renal pelvis, which changes into the ureter. So now we can see the renal sinus is a space within the kidney. Is occupied by renal pelvis, calyces, minor and major, vessels and nerves, and variable amount of fat. This fat, which is called the perirenal, yes, fat. When we look into the internal structure of kidney, we can see that kidney possesses the outer cortex and inner medulla. The lobes are formed by pyramids, the renal pyramid, and the associated cortex, renal column. So if you find a pin here, you need to write the renal pyramid. But if you find a pin here, yes, so this is the renal column, which belongs to the renal cortex. Renal papilla is an apex of the renal pyramid on the cribriform area, where accumulates a final urine, so which is drained into the minor renal calyx. Minor renal calyx resembles a glass for wine. It differs from the major renal calyx, which has the name the calyx, but it doesn't resemble. It doesn't resemble calyx. And look, such perfect picture you can see only in the atlases or an X-rays. Yes, normally in our specimens you will see that sometimes you will find problems, yes, with finding. So what can you help you? If you can see that here it's a renal pyramid with the renal papilla, so around the renal papilla should be the minor renal calyx. And that's it, yes, so it's easy, yes. Around the renal papilla should be the minor renal calyx. It's important to remember this renal papilla, because in some disease, the diabetes, happens the necrosis of such renal papilla. When you will be at the course of nephrology, you will hear about it. Yes, necrosis of renal papilla in the diabetes. Each minor calyx is intended by renal papilla, and 2 or 3 minor renal calyces form the major renal calyx. And the renal pelvis receives 2, in our picture, there are 3 major renal calyces. So 1, 2, and 3 major renal calyx. Nephron, it's a complicated structure positioned partly in the medulla and partly in the cortex. The kidney consists of about 1 million nephrons, the units. Also, in kidney, we have the tubular system. So, medulla consists of highly convoluted tubules that ultimately empty urine into the drainage system. There is selective reabsorption of desired amounts of water, electrolytes, so it changes, yes, some electrolytes, yes, they leave, yes, this tubular system, some they enter, yes, so it changes here. And the other solids and secretion of materials, yes, that they take place on the glomerular and tubular system. So such tubular system keeps the body in good metabolic and acid-base status. Arteries of kidneys arise at the level of the intervertebral disc between the L1 and L2 vertebrae. The longer right renal artery, because abdominal aorta is slightly to the left, passes posterior to the inferior vena cava. Look that here we can see some cross, yes, venous cross and arterial cross. And this venous cross is anteriorly to such arterial. So arteries should should run posteriorly to the veins. So we talked previously, yes, about it. Yes, that look, the veins, they achieve the renal hilum, yes, anteriorly, and arteries are behind these veins. Each artery divides close to the hilum into the 5 segmental arteries, and each supplying a segment of kidney. So we have 5 segments of kidney. Of course, I wouldn't ask about such segments. It's good to know that the kidney is divided into the 5 segments, and remember that the segmental artery supplies each segment. Now let's look into this picture, and I need to correct this picture. Correct, because there is something wrong. I will explain you soon. So, firstly, let's look from the renal artery. There is a segmental artery. Yes. So, 5 segmental arteries, because we have the 5 segments. And next, the segmental artery provides a lobar artery, And look, and here is the mistake, because this is not the interlobar. This is the lobar. Look, this is the segmental, yes, this is. But this one, yes, it's a lobar artery. So this is the mistake. Interlobar arteries, yes, interlobar. There are these arteries. So look, this lobar artery, so this is the mistake, the lobar artery divides into the interlobar arteries and travel between the pyramids. So it's correct. So be careful of this picture. Next, the interlobar artery forms an arcuate artery. Arcuate artery is near the junction of the medulla and the cortex and gives off a right angles to the parent stem. So, segmental, lobar, interlobar, and arcuate. Let's go to the next. From the arcuate arteries sent an interlobular. Yes, there were the interlobar and now the interlobular. So this is difference. Interlobular, so it means they are much smaller, yes, than interlobar. Interlobular arteries, they pass to the cortex from the arcuate artery, yes, and form the arterioles which supply the glomeruli. So one more, again the same mistake. This is the lobar artery. Here it's an interlobar, and near between the cortex and the medulla, there are at the angle, there are the arcuate, and next the interlobular. So be careful. Cortical glomerulus, the renal or Malpighian corpuscle, they're located, yes, in kidneys, and the cortex consists of thousands of cortical and juxtamedullary. Juxtamedullary, so it means that they are close to the medulla of kidney. Juxtamedullary, yes, glomeruli. So they are filtering units. Glomerulus, it's a coiled mass of capillaries which are surrounded by the Bowman's capsule. Was it during the histology or not? So I don't need to explain. So only I will focus on the anatomy. So glomerulus is formed by the afferent glomerular arteriole. So blood flows to the glomerulus, and efferent glomerular arteriole. So blood flows out of the glomerulus. So look, here is the next strange network. But this network, we call it the arterial network, yes? With the liver, yes, with the portal venous system, was strange venous network. Here we have the strange arterial network, because the artery, yes, and next they change into the next artery, yes, afferent arteriole, yes, glomerular arteriole, and efferent glomerular arteriole. So now let's look to the pathway of the primary urine. So fluid leaves the capillaries and passes into the lumen of the nephron. And first there is a proximal convoluted tubule, and next there is the loop of Henle. Loop of Henle is composed of the firstly of the descending limb, and next it changes into the ascending limb. Next there is a collecting distal convoluted tubule, and finally there is a collecting tubule. And here we can see the openings of the papillary ducts. So they are located at the renal papilla. So we can call it the cribriform area of renal papilla. In some of our specimens, you will see it, yes, such a cribriform area of the renal papilla. So here runs the final urine. So the final urine, yes, from the renal papilla, firstly it's a minor renal calyx, next it's a major renal calyx, renal pelvis, ureter, urinary bladder, urethra, and exterior environment. Dr. Ostrowski will explain you an X-ray, so shortly only I need to show you this calyx, minor renal calyx, the major renal calyx, renal pelvis, ureter, urinary bladder, and next the urethra. Several renal veins, they drain to form the renal vein, and now we know that the vein leaves anteriorly, renal vein anteriorly to the renal artery. The left renal vein is longer and passes anterior to the abdominal aorta and posterior to the superior mesenteric artery. It Which renal vein drains into the inferior vena cava? Look that the right renal vein is shorter. Also, with the male genital organs or female genital organs, you will see that to the left renal vein drains the left ovarian vein or left testicular vein. Yes, there is a difference at the on the left side, because on the right side the ovarian vein or testicular vein, they drain directly to the inferior vena cava. It will be the same with the suprarenal vein. Yeah. We will see soon. The renal lymphatic vessels, they follow the renal veins and drain into the lumbar lymph nodes. Nerve of kidneys, they arise from the renal nerve plexus, consists of sympathetic and parasympathetic fibers. The renal plexus is supplied by fibers from the abdominal pelvic splanchnic nerves, especially the least splanchnic nerve. So from the T12 level segment, yes, of spinal cord. Remember, we had the greater splanchnic nerve, the lesser splanchnic nerve, and the least splanchnic nerve from the T12. Ureters connect the kidneys to the urinary bladder, run inferiorly. There are the muscular ducts with a peristaltic motion promoting the movement of urine. There are 25-30 centimeters long. They have the narrow lumina that carry the final urine, yes, from the kidneys to the urinary bladder. And when you find a pin, yes, into the ureters, we will expect from you recognizing the parts of ureters. So remember, we have the two parts of ureters: the abdominal part of ureter and the pelvic part of ureter. Pelvic part which enters the pelvic cavity. Abdominal parts of ureters adhere closely to the parietal peritoneum and are retroperitoneal, so there are primary retroperitoneal organs throughout their course. So look, the abdominal part of the ureter is crossed by the root of the mesentery of the small intestine, yes? So now the root of the mesentery is removed, yes, for showing us this right ureter. The pelvic part of the ureter passes over the pelvic rim and begins where it crosses the bifurcation of the common iliac artery, but it's only the left ureter, because the right ureter crosses the beginning of the external iliac arteries. Turn to some part of the ureter, because today you will see the passage of the ureter, this abdominal part. Maybe it's not visible in this picture, but look, that ureter, it crosses the psoas major muscle, and with the psoas major muscle is pierced by the genitofemoral nerve. Genitofemoral nerve, it's a branch from the lumbar plexus. Very characteristically is that it pierces the psoas major muscle, and the ureter crosses this genitofemoral nerve, And for example, where some stone, yes, passes through the ureter, yeah, we can have some very very huge pain, yes, in the inguinal region. The pain, it radiates to the scrotum in male or to the labia majora in females. Why? Because the stone which passes through the ureter, yes, it presses, yes, this genitofemoral nerve. Yes, a genitofemoral nerve, besides supplying of the skin, it also supplies the skin around the labia majora or scrotum. Yes, so you need to remember about it. Yes, because it's visible and you will see today it. So I need to tell you about it. Yes, the genitofemoral nerve. Please remember, it's a genitofemoral nerve is composed of two parts: the femoral part and the genital part, and such genital part which supplies the scrotum or labia majora. So it's possible to feel some pain, yes, there. So now let's return to the pelvic part of the ureter. And pelvic part of the ureter in male passes posterior to the deferent duct. Look, this is the ureter, this is the deferent duct. And we can see that the ureter passes posterior to the deferent duct. Oh, here, this is the deferent duct, this is the ureter. So the ureter passes posterior to the deferent duct. It enters the posterior superior angle of the bladder, just superior to the seminal vesicle. In female, pelvic part of ureter passes medial to the origin of the uterine artery. Look, this is from the internal iliac artery, passes the uterine artery. Uterine artery. And next, firstly, the ureter passes medial to this uterine artery and continues to the level of the ischial spine, where passes under the uterine artery in the mesometrium. It's very important, the topography of it. In some American tests, you can find that very often they ask about it, because for the gynecologists it's a very important relation between the ureter and between the uterine artery. And how to remember how they pass, yes, how they run. Look, that the ureter, yes, and in the ureter we have water, yes, a water, the final urine, yes, the water. So it's like a river, yes. Artery should be like a bridge, yes. So the bridge should be above the water, yes. So, and it's very easy to remember, yes. Artery is a bridge, the ureter is a river. Next, the ureter passes close to the lateral part of fornix of the vagina and enters the posterior superior angle of the urinary bladder. Very rare, but happens for the gynecologist that they, when they make some gynecological operations, they cut a ureter. So it happens, yes. They need to remove, yes, the vessel, they need to close, yes, the vessels, yes. But sometimes it happens, yes. It's very rare, but it happens. The ureter has constructions. There are potential sites of the obstruction by ureteric, the kidney stones. So they are demonstrated radiographically using the contrast medium. So there are the three places of the constructions. The first is at the junction of the ureter and the renal pelvis. So here, where the pelvis changes into the ureter, yes, there is the first flexure, yes. So here is the first construction. The second one is where the ureter crosses the rim of pelvic inlet. So where it crosses the vessels, yes, on the right side, the right external iliac artery, on the left side, the common iliac artery, the left. And the third construction is during the passage through the wall of the urinary bladder. So, in the place where ureter enters the urinary bladder. So I forgot that I have a slide, yes, for explaining this ureteric pain. Okay, so I will repeat one more time, yes, so you will better remember. So, the nerves of the ureter, they derive from the renal, the aortic, superior, and inferior hypogastric plexuses. Why inferior hypogastric plexuses? Because we need to remember about the pelvic part of the ureter. Visceral afferent fibers convey pain sensation, follow the sympathetic fibers to the spinal ganglia and cord segments through T11 through alto. And the ureteric pain, yes, this ureteric colic, is usually referred to the same side, on the same side, ipsilateral, so it means in the same side, to the ipsilateral lower quadrant of the anterior and abdominal wall, and especially to the inguinal region, the thigh and scrotum in males and labia majora in females. So it's because such genitofemoral nerve, which passes posteriorly to the ureter. Urinary bladder temporarily stores urine that varies in size, shape, position and relations according to its content and the state of neighboring viscera. It's a hollow organ with strong muscular walls. Lies inferior to the peritoneum, rests on the pelvic floor. In infants and children, the urinary bladder is located in the abdomen even when it's empty. And enters the greater pelvis by the 6 years of age. In adults, an empty bladder lies almost entirely in the lesser pelvis, posterior and slightly superior to the pubic bones. As a bladder, urinary bladder fills, ascends in the extraperitoneal fatty tissue of the anterior abdominal wall. Look, behind the pubic bones we can find some space which is called the retropubic space. Retropubic space. This retropubic space is filled with the fat. So when the urinary bladder is more full, yes, so it presses this retropubic space, which is filled with the fat. And full bladder, yes, when we can't pee, yes, so full bladder may ascend to the level of the umbilicus, yes. Sometimes we are saying, yes, that my urinary bladder ascends to the stomach. The urinary bladder, when it's empty, somewhat it's tetrahedral shaped, has an apex. It points toward to the superior edge of the pubic symphysis. Look, this is the pubic. This is the pubic bone. Yes, the facies symphysialis, and here. This is this retropubic space, which is filled with the fat. So, this is an apex of the urinary bladder. Next, it's a body of the urinary bladder. The fundus, the base, which is formed by the posterior wall, and which is somewhat convex. The neck of urinary bladder, so the fundus and inferolateral surfaces meet in this neck of the bladder. And the uvula, it's a slight projection of trigon of the bladder. Of course, in our specimens, we wouldn't expect from you to recognize such parts, yes, the apex, body, or fundus, yes. We put a pin into some particular specimens. So we have some parts, yes, of it, but during the pin test, it's enough to call it the urinary bladder, and I will show you some other pins soon. The fundus of the bladder in males is related to the rectum and the prostate. So look, this is the fundus, yes, and is related to the rectum and prostate. In females, the fundus of the urinary bladder is closely related to the anterior wall of the vagina. Here is the vagina, and the fundus of the urinary bladder is related to the anterior wall of the vagina. The bladder bed is formed on each side by the pubic bones and the obturator internus muscle. We will talk about it with the lower limb, and levator ani, which belongs to the pelvic diaphragm, and posteriorly by the rectum and the vagina. Enveloped by loose connective tissue, the vesical fascia. And I need to emphasize it, this name of the muscle, because some of students, but it was in previous years, now because I emphasize it during the lecture, yes, so I didn't find more mistakes. So remember the name of the muscle, yes, the detrusor muscle, because sometimes some students had written me the detrusor muscle, yes, so no, it's a detrusor muscle, the detrusor muscle, yes, so it means that it only belongs to the urinary bladder, yes. So, and very often we pin it, yes. So, if you find a pin, yes, in the wall of the urinary bladder, you need to write the urinary bladder, that, or without that, but the detrusor muscle should be, yes, the detrusor muscle. So, it forms the wall of the urinary bladder. Toward to the neck of the male bladder, muscle fibers form the involuntary internal sphincter. So here we can find the internal orifice of urethra. I will explain it next. Some fibers run radially and assist in opening the internal urethral orifice, and in males, the muscle fibers in the neck are continuous with the fibromuscular tissue of prostate. So sometimes it happens that where the cancer is from this part which forms the neck of the urinary bladder, and next it goes to the prostate. In females, the muscle fibers in the neck are continuous with the vagina. I'm sorry, with the urethra. I'm thinking about some other things. The trigon of the urinary bladder is formed by both ureteric orifices and the internal urethral orifice. So look, there is some trigon, yes? And look, this is the right ureteric orifice, this is the left ureteric orifice, and here it's one single internal urethral orifice. Look that this trigon belongs to the fundus of the urinary bladder. Yes, why? Look, here is a prostate. We know that the prostate is related to the fundus of the urinary bladder. So, the trigon of the urinary bladder is located in the fundus of urinary bladder, and here the inside of the urinary bladder, yes, is smooth. Yes, the mucus here is smooth because other parts of the urinary bladder are rough because we have a fault, yes, in the urinary bladder. Here the mucus is smooth. In male pelvic cavity, the peritoneum passes from the anterior abdominal wall next to the superior pubic bone, along the superior surface of urinary bladder, inferiorly on the posterior ends of seminal vesicles, and posteriorly lines the rectovesical pouch and covers the superior part of rectum. Posterior-superiorly become the sigmoid mesocolon, this peritoneum. In female pelvic cavity, the peritoneum passes from the anterior abdominal wall superior to the pubic bone. Vesical arteries are the branches from the first branch of the internal iliac artery, so from the umbilical artery. But in some authors say that there are direct branches from the internal iliac artery. The inferior vesical arteries supply the fundus and the neck of the bladder. And also some branches from the obturator and inferior gluteal arteries. The veins have the same names as arteries, so they correspond to the arteries and are tributaries of the internal iliac vein. Next, internal iliac vein, here is visible better. Internal iliac vein, yes, it forms the common iliac vein, and next the inferior vena cava. In males, the vesical venous plexus combines with the prostatic venous system. In females, the vesical venous plexus receives blood from the dorsal vein of clitoris and communicates with the vaginal and uterovaginal venous plexus. We will talk about it also with the male and female genital organs. Lymphatic vessels leave the superior surface of the bladder and pass to the external iliac lymph nodes. Lymphatic vessels from the fundus, they